The health sector is staring at a possible shutdown in the next 72 hours as the government and KMPDU officials are yet to arrive at a deal to avert a planned strike by doctors. Labour CS Simon Chelugui is appealing to the medics to suspend the strike and allow for talks. This comes as KMPDU officials remained non-committal in calling off the planned strike. Kamau with the details of the standoff at a time when the country is battling the COVID-19 pandemic.
Solidarity forever, for the union makes us strong.
It is a race against time as the government engages in what would seem as a spirited effort to forestall the planned health workers' strike that could disrupt health services countrywide, effective midnight on Sunday.
Look at the reasons as to why we are going on these strikes. There are issues that should be very simple if you have effective management. And that is why we have been asking for a Health Services Commission.
Cabinet Secretary for Labour Simon Chelugui said the Ministry of Health is working round the clock to engage relevant agencies. Chelugui pointing out that on Wednesday, the Ministry of Labour and Social Protection convened a tripartite meeting to deliberate on grievances raised by the three trade unions, namely the KMPDU, KNUN and KUKO.
I wish to call upon the unions to suspend their strike of 7th December 2020 as the government works around the clock to address their grievances. Think ourselves as Ministry of Labour to offer our conciliatory responsibility to bring the parties or employers and employees to the table. And that is our mandate, that is our responsibility. And we are saying our doors are open.
Chelugui says so far they have undertaken the following measures: ordered KEMSA to release all PPEs, engage NHIF to offer comprehensive medical cover, urge county governments to expedite the implementation of a comprehensive medical cover through NHIF, establish a multi-agency committee to look into health workers' grievances, and set up a technical team comprising the Ministry of Labour and representatives of the three trade unions to map out issues raised with a view of addressing them conclusively.
Continue to prioritize the safety of our frontline medical workers and ensure that they have the best possible environment to work in, especially now that the country is confronting the second wave of COVID-19 pandemic.
The Kenya Medical Practitioners and Dentists Union, appearing before Senate committee, however, remained non-committal on whether the looming strike will be called off.
There's been no engagement as we speak with the Council of Governors. The Ministry of Health engagement was once in the first week. Now this week is this is the last week now, we are seeing now frantic activity to start engaging. So there's a meeting called in the Ministry of Labour yesterday. And the police one, and we put it very clear, and I put it myself also very clear to them. Can we dialogue? Can we conciliate? Fine. We have been available throughout. When we wanted to talk, you had other priorities. When you've given this notice, yes, come dialogue. But the question is, the experiences that I've just narrated, that are currently ongoing, that are realities, can they wait for another 14 to 21 days?
The strike takes effect Monday. Kamau reporting for Channel 1 News.